Hi, everyone. Welcome to the webinar for NAPS, or the North American Prodromal Synucleinopathy Consortium for REM sleep behavior disorder. My name is Yoel Ju. I'm a professor of neurology at Washington University, and I'm one of the co-principal investigators for the NAPS Consortium. And I will be providing a very brief overview of what NAPS is about. Just quickly, RBD, or REM sleep behavior disorder, is a disorder characterized by acting out of dreams. And when people with RBD have a sleep study, we find that they have lost the normal paralysis that is usually present during REM sleep. Now, this is the stage of sleep when people usually dream. And interestingly, people with RBD tend to have dream content that's very violent and active. And so the punching or kicking or jumping out of bed that goes along with acting out of these active dreams can result in injury to the individuals or to their bed partners. At the bottom of the screen is a description of one such event from the first description of RBD by Dr. Carlos Schenk back in 1986. And you can read for yourself how these types of RBD events can be very frightening and potentially lead to injury. Fortunately, the symptoms are usually treatable quite effectively with medications that we already have. Another aspect of RBD that makes it of great interest to neurologists and to you is that there is a strong link between RBD and neurodegenerative diseases. So individuals with idiopathic or isolated RBD have no other neurological symptoms. RBD is the only thing they have. However, when people with idiopathic RBD are followed over time, you can see here on the upper right, this is the proportion of people remaining neurologically normal. About 6 to 8% per year develop a synucleinopathy. Synucleinopathy is a category of neurodegenerative diseases that are characterized under the microscope by these clumps of synuclein, shown here in the pink, clumps of synuclein, which is a protein in the brain. These diseases include Parkinson's disease, dementia with Lewy bodies, and multiple system atrophy. Now, these three disorders are quite different in terms of their symptoms, but they do have this commonality when the brain is looked at under the microscope. And so they're all called synucleinopathies. So we think of idiopathic RBD as, at least in the majority of cases, as representing a prodromal synucleinopathy, meaning a small amount of synucleinopathy disease is present in the brain, but not causing a neurodegenerative disease yet. Close to half of people with RBD who develop a synucleinopathy will get Parkinson's disease, about half will get dementia with Lewy bodies, and then the rest will get a multiple system atrophy. We currently do not have a good way of knowing which one someone may develop or when. And probably the biggest question we have is there anything we can do to prevent or slow progression to one of these diseases? And right now, there are no effective treatments yet. However, we know that RBD represents a window of opportunity during which treatment of the synucleinopathy is most likely to succeed and hopefully stop the progression prior to development of any symptoms of a synucleinopathy. So the overall NAPS mission is to go from the knowledge that RBD is a prodromal synucleinopathy to get to neuroprotective clinical trials. But there are some barriers to doing those clinical trials. And so the mission of NAPS is to overcome those barriers and enable successful clinical trials. Some of those barriers include not having good biomarkers, meaning things in the blood or other body tissues or on brain scans that can track with the amount of disease, because we want to be able to do a clinical trial where we can follow a biomarker and assess the effect of a treatment on a biomarker rather than waiting for people to develop synucleinopathy. We also don't have a lot of patients who have been diagnosed formally through a sleep study with RBD. And so we want to be able to pool together a large number of trial-ready individuals with RBD. And also prior to NAPS, although there were large centers that followed individuals with RBD, each center kind of had their own way of assessing these participants. And so we want to be able to standardize the assessment so that we can compare apples to apples and be able to pool all the data from the different centers on RBD. And so the NAPS Consortium hopes to overcome those barriers through enrollment at these sites across the US and in Canada. We currently have 9 actively enrolling sites, and participants who enroll at these sites undergo a protocol, including a clinical assessment. We obtain blood, spinal fluid in some participants, and various brain scans. And this is done in a standardized fashion across all of the sites. The NAPS Consortium is supported by the American taxpayer through the National Institutes of Health. Here are the grant numbers here. And there are a large number of investigators at various institutions around the world and who are contributing scientifically to our analyses. And then just of mention, all the data and samples that we collect are being shared with other investigators through these public repositories that are supported by the NIH as well. In terms of where we are, we've actually seen 428 unique individuals for at least one visit. There is a longitudinal component, meaning we see people back once a year, and some of these individuals we've seen back 4 times already. This is as of the end of last month. NAPS 1 ended a couple of years ago, and we are now into the NAPS 2, and we are really prioritizing seeing people back that were previously seen in NAPS 1 so that we can collect those longitudinal biomarkers over time. However, we are also enrolling new participants as sites have bandwidth so that we can maximize our enrollment. In terms of the NAPS RBD registry, of course, you are all registrants, so you know about this. We set up the registry to be able to enroll new individuals from outside of our existing centers. And the registry has been much more successful than we imagined. So we have, at least as of the end of May, we had 859 registrants. And you can see the majority of people on the registry either have RBD or think they might have RBD. And so now we know that we have a very large pool of potential participants to enroll into NAPS, as well as people who may be eligible to enroll in future neuroprotective clinical trials. In the upcoming talks by Dr. Zveranovic and Bove, they will be discussing more in terms of how people on the registry can become more involved with RBD research and with the NAPS Consortium. Here is a list of the leadership for the NAPS Consortium. It is a very, very huge team effort. And of course, I do want to mention that none of this would be possible without the time and the effort of the participants who all have RBD. And so if any of you are NAPS participants, I want to thank you for your time. And for those of you on the registry, again, thank you for joining the registry. And we do hope that we are able to continue to engage with you and keep you interested and informed about RBD research. Thanks for your attention.